Hello and welcome to another episode of the Soul Hero podcast. I'm your host, Dr. Rali Georg, and today's episode is about letting go of blockages with a very, very special approach with an osteopathic treatment. What is osteopathy, what it is about, and how it works, everything you need to know, you will see in this episode with my amazing guest, Dr. Wright. And you will see the whole process of the appointment, from the diagnosis and then all the medical background. Well, I'll skip that part, but how the diagnosis is working and how important it is to have a nice structure, to have balanced body and to release all the blockages, and also the pain, which is also a result of not only physical situations but also mental and emotional. How osteopathy is working, how the treatment is going, everything you can see is in this episode. Super grateful for the opportunity to film it. So a big thank you to Dr. Wright. Enjoy the next episode, and don't forget to take care of yourself, of your soul, of your body, of your mind and your emotions, because it's all about the balance. So enjoy the next episode. Don't forget to subscribe, like and share, and see you soon. Today we have Dr. Wright here. Many of us know him as a founder of Show Up. It's one of the greatest communities for well-being in Barcelona. And not only Barcelona, also in other cities and countries.
Yeah, we're in Dublin, we're in Malaga, Madrid, in Copenhagen, in Denmark, and in Edinburgh at the moment in Portugal.
Wonderful.
Yeah.
But you're also an osteopath, an Oxygen Advantage advanced instructor, and
Advanced Oxygen Advantage instructor.
Yeah, thanks.
And
also dynamic neuromuscular stabilization.
Yeah, I did some courses at the Prague Institute with around the DNS, or dynamic neuromuscular stability.
Great. Yeah. So let's talk about osteopathy first. What can you tell us, as you will explain it to someone who would have no idea what it is?
Osteopathy is a mixture of all different types of allied health practitioners or practices, where we incorporate tools or usages from, say, Eastern medicine approach, and then incorporating the Western approach also. So the way I like to explain this, everyone knows what a physiotherapist is and a chiropractor. We're the mixture of both of those as they come together, and we look at the body in a more holistic approach. So we look at how everything functions, not just specifically on a spinal level, but also on all of the systems. So the lymph, the musculoskeletal system, the neurological system, and then the respiratory or the cardiovascular, and how everything mixes together. Work with the idea of being able to optimize the flow, or how the body heals itself, to be able to then allow for the body or the mind to be able to return back into the normal rhythm.
To heal on what, for example?
It depends on what people come in with. So every client's different.
Like pain?
Mainly, the majority of people that would come through would mainly be around sort of back pain, shoulder, neck pain, general sort of presentations. But then we can work with all different types of conditions and pathologies and so forth as well. So for instance, with me at the moment, with Show Up and things, I get a lot of clients come to me with anxiety, stress, and then I utilize different types of breathwork practices or functional training or breathwork retraining, incorporated into my osteopathic practice and manual therapy.
Okay, it's like an individual approach.
Depends on every person that walks in. But then I also do rehabilitation for sporting injuries and biomechanics and functional movement. So I look at how people function when they squat, when they lift, when they walk, when they run.
Yeah.
Depending on who walks with it all.
Great. And well, then what about? I mean, holistic. So it's not only the physical part. You know, it's as I understand it, it's also about the blockages or the blocks we are like having from also emotional, mental.
Yeah, I think that there's two types of ways to look at this. Is like when someone comes to see you, there's normally either there's something that's happened, so it's an external trauma of some sorts that has then presented itself, whether it's been a car crash or you've fallen over or you've injured yourself while playing sport or something of the sorts. Right?
Yeah.
And then there's something that has continually been building or progressing, and then has eventually formed into a physical pain or restriction, and that can come from an emotional cause for sure.
And when is the right time? And from my dental background, I know that how important it is to diagnose early, so the prognosis and the treatment is easier and successful.
I think that everyone should consistently see some form of practitioner, whether it's someone who has an idea as to what to look out for, or even I think with osteopathy we're more about preventative than we are with actual cures.
Sure.
We handle that on a day-to-day basis. That's normally the bread and butter of the clientele that walk in. But I think that the idea of what osteopathy is similar to chiropractic to a certain degree, except we don't see our clients as much because we try and give them the tools to then look after themselves, is so that you would get consistent checkups. Maybe that might be for some certain cases once every 8 weeks, or one might be every 3 months, or it might be every 6 months or a year.
Yeah.
But to be able to have someone that is telling you when there's something that might need to be looked after or taken care of or fixed, so that, and then lead them into, a more homeostatic or a better flow of how everything is running within their own bodies.
So then for the long-term results and prevention.
Yeah, so prevention of any further conditions or pathologies or so forth, or physical ailments. Yeah.
What about, I've been to a chiropractor a lot. From my job back then for 12 years, I was working like this, like doing some fillings or whatever. And they said that there was like a beginning for scoliosis I have. Never did an X-ray. If you think will be beneficial, we can do one, but my complaints or pain isn't so bad, so I'm like, it's fine now. And what they do is like, they correct the misalignments with some sound. It's like it's like the same with osteopathy, or it's more like
with sound in particular.
Well, when some joint is like not in a balance, then when you're in a chiropractic treatment, they're like
they adjust you.
And it sounds like
you're the crack, popping.
That's it.
Yeah, we do adjusting also.
Oh, great.
Yeah. So
that's gonna be fun.
Yeah, a chiropractor will mainly work with like the neurological system and the axial skeleton.
Yeah.
Sometimes you'll get some practitioners that do a little bit of soft tissue work as well. But mainly with chiropractic, it's about they'll mainly treat the axial skeleton or the skeleton, and then how the neurological flow out of that, or even they go a bit deeper as well into some other systems. But with an osteo, we deal with the same as what a chiropractor would. We will treat and adjust the spine, but for us, it's about utilising that adjustment and then enabling everything else to be in the same optimal flow as well. So we spend a little bit longer with our clients. So like a normal osteopathy session is, an initial can be, depending on the country, because in Spain they normally expect a little bit longer treatments. It's an hour initial and 45 for a consultation for a follow-up. In Australia it's a bit shorter.
Okay.
For a couple of different reasons.
In Germany it's 1 hour.
Yeah. I think it's a bit long. I think that a lot of work can be done a little bit shorter. I think that's mainly a bit of over-treating and an expectation from clientele.
And depending on the pain and the condition, I guess.
Yeah. Obviously, depending on the person.
Yeah.
But yeah, we do the adjusting, but we also do all of the other type of techniques, which you'll find out.
Well, why I'm here?
Yeah, tell me.
Yeah, I mean, one thing is my right shoulder. I'm like try to stay flexible and do a lot, and I have to think that there is still some lock here because I cannot move it like I would love to.
Yeah.
The pain is gone now. I mean, it's not so bad, but it's still like something is holding it.
In the front or the back of the shoulder?
Back in front. I mean, when I'm like this, it's okay. Like the left side, everything's fine.
Yeah.
But when I go here, it's.
And you get some pain in the front of the shoulder on that side.
Yeah, and I cannot do more. And I just like to move when it's possible.
We'll find out why.
Why? Yeah, sure. And to like integrate it to my posture, so the balance will be back again.
Yeah.
Second thing is I think it's temporary because it's about my right knee. I'm working on my side splits right now, so I tend to overdo sometimes in the time.
Okay.
After 2 days is fine. But the other thing is I have a long story, with my particularly the left foot. The condition how valgus, it's like that misalignment of the big toe. It's especially in the left foot, and I've been working a lot the last few years, and now it's better. It's even more flexible. I can move, and they show me a few exercises.
Yeah.
They're kind of boring, so I don't do them a lot. But my aim is
about improving your foot mechanics.
Sure.
And spreading your toes.
That's right.
Yeah, and to try and improve the ability for you to stabilize and also to decrease.
That's right, the pain and so on. And I still, avoid high heels, obviously, because they're killing me. But what I want, I hope you can help with this, is to like learn to walk properly again.
We can do that.
If that makes sense, because I want to integrate those exercises, or just to have more, awareness, or how is the right position, so I can exercise all the time with every movement, and that's actually why
you're here.
I'm here. Yeah.
Okay, so for the foot, not specifically.
Not specifically for the shoulder. I mean, it's been like this like forever.
But you have a scoliosis that you said.
And I think so. They said I don't know if something visible like on the I can see on the back.
Yep.
There are a few positions that.
How long have you had the shoulder pain for?
It's like part of months. It's like forever.
A few years?
Yeah. Like
around about?
Yeah. I don't know. I mean, 10 years or as long as I worked as a dentist, there was also back and neck pain.
Yep.
Now it's better, but my shoulders was always like
And you had X-rays done on the spine, and they didn't see anything in particular of note.
No.
Just the curvature.
It's funny because 5 or 6 years ago, when I really had very very bad pain because of the house, I went to an orthopedist, and he said, "Yeah, let's make surgery." I was like, "Okay, well, wait, yeah." And I was like, "I'm not gonna." I mean, and you know how aggressive it could be. They're like removing some.
Well, a surgeon gets paid when he does surgery, so some people are more likely to push towards those things.
Yeah, but I mean, and I saw back then the X-ray, and sure, it was like. Always that there's some problem, but after like 2 years with a physiotherapy and chiropractic or so on, the pain was completely gone. I'm sure I make the exercises, and I wear some like ugly shoes and stuff.
I think this is a good point to touch on that, because a lot of people aren't willing to be able to put the work in to be able to see the benefit after 2 years of doing the actual work and not wearing high heels. Some people just want a quick fix and to be able to have the surgery done.
Well, not wearing, but just like avoiding.
Yeah.
To wear them. Yeah.
But for you, in your case, you're willing to be able to do the work
Sure.
And you've obviously seen a fairly decent change
And
and benefit.
yeah, sure.
But for others who aren't able to be able to build motivation to do so, surgery is still an option.
Or the knowledge, the information that it's possible to be
comes
done.
down to it as well.
Sure, because you go to a doctor, orthopedist, he knows what to do. As you said, sure, surgeon, but still, and he said, have to do surgery. And you're like, okay, well, maybe that's the way. And if the pain is like really bad, so I guess that many people will do it. But if you check, there are many other opportunities, and I'm someone I just want to just try everything else, and especially when it's like about the general condition, like health in a holistic way.
Yeah.
So yeah.
Well, it's nice that you mentioned it, because I agree that the foot control also plays a part in the whole system, and not just specifically just how the jaw sits, like you mentioned before.
Example,
but it does.
Yeah.
But it also plays a part into how the neurological system functions as well, and then how you hold yourself, back pain, and everything else that plays into part. A lot of people talk about foot control and how it relates to hip health and knee health.
Sure. Yeah.
Right, but it also relates to how spinal and thoracic, and then eventually just up into your occiput and how the head is held. Because if you're not able to support through your foundation, you've always got a slight little bit of a change that's happening through each part of your set, or through your skeleton and through your body. So if we can start to teach people how to foundationally walk, or to structurally, to be able to control their feet,
that's right.
Then you'll be able to hold yourself in better positions and then function at a greater level as well. So I teach a lot of people how to walk.
Yeah.
Well, we can do that.
And the right posture, because we don't remember how to even to stay or sit or walk, and the movement is even more challenging, because everything is moving, but still the posture is a big thing for me, and there are many tensions and pain conditions which could be I think avoided or prevented by the right movements and posture too. Right.
Okay, back to you.
Yeah.
Medical history. Yeah. And just walk back and forth. And keep going. Just back and forth, And come out. So what I'm looking for, if you just keep walking. I'm looking at the way in which you hold or stabilize through the hips, the way in which you move through your shoulders, just resting your arm down and just walking normally. The arm swing, the way in which you stabilize through the ankle, how the foot contacts the ground, if you're getting any contraction through your toes. All of this sort of stuff that you probably would have been covering once you found out about the usage and trying to spread your toes. Mm-hmm. The same sort of thing. But then looking at how that works up through the chain. So for you have a little bit of a valgus force when you're walking, the knees slightly come inwards a little bit. Mm-hmm. You have a little bit of a drop through your ankles. Actually, more so on your right than you do on your left. Your left foot actually looks like it stabilizes quite well. I'm assuming you put a lot of effort into your left foot, no?
Yeah.
A little bit of ankle shaking through the left side. But good control through the hips. Shoulders sit quite level. When I was having a look at your shoulder when you were standing up, you have a slight little bit more of an internal rotation on the right hand side than you do on the left hand side. Like even when you stand there now, your left shoulder sits out just a little bit more than this one. And you feel like this one's slightly more internally rotated. You can see that when you walk, even just slightly.
Okay. And also my hips.
The hips are Not too bad. Stabilizing quite well through both sides. Okay, let's do a squat.
Like
You can widen your stance a little bit. Yeah, like a normal squat.
I like normal squat.
Yeah.
Like right then. Or okay.
Straighten your legs. Sit the legs up nice and straight. So you're doing it properly. Yeah, now squat. Good. Can you go any lower?
This.
Come back up. Widen your stance a little bit more. Good, now squat. Should be able to go down a little bit further.
Yeah.
Good. Any pain through the knees at all when you do that?
No, I'm not, but when I was closer.
Yeah, because more load goes through the knees when you've got them together. 'Cause you can't.
That's right, yeah.
Yeah. Okay. A little bit more shaking through that right side. The ankle does drop down here though when you do that. See if when you squat, you can slightly spread your toes more. So you've got this one coming out and you can base that. You can provide stability through the toe into the arch so that it doesn't fall inwards.
And what do you think about this 3-point stabilization? Like
Right through the toes, through the ball and through the heel? Sure.
yeah,
I think it should be the full foot. As long as it's not through the ball, through the toes, and then through the heel. As long as they're all contacting, and you're providing support through the foot, and the ankles aren't rolling into too much pronation.
Well, that's the problem. It's hard to
Yeah. Well, then you can think about, okay, well, why is that doing that? For you, do you have a little bit of a change through that metatarsophalangeal or metatarsophalangeal joint on the toe? So you're more likely, it shows that your big toe is going to sit a little bit further inwards.
Yeah.
So you're not stabilizing through that toe as much as what you probably should do so.
Yeah.
Because of the change that's occurred, or the shoe choice that you used to use before you became aware, before you were educated. So when you do this now, see if you can get just a little bit of toe pressure to push down through your toes. Keep your ankles nice and high so you prevent a good spread.
Yeah.
Good spread. And now keep the arch up, but not taking the ball of the foot off the ground. Yeah, I know it's difficult to try and imagine that the foot is even just bending. Good. And now go into a squat.
Like this, or
No, you want to keep the toes nice and flat and spread. Good.
the arch. Oh,
Yeah, the
that's
arch, and now go into a squat. And you almost fall over. You can bend the knees a little bit as well. Good. See how the left ankle falls in? Yeah, see how the ankle falls in? And we want to keep that knee out.
Okay.
Go again. Knee out. You've got this. Keep the head up, head up.
Yeah, I want this control. I'm doing this.
Hand up. Good. Go down. You haven't seen an osteopath or a chiropractor in Barcelona?
No.
Yeah, I'll look this one as well. You speak German also?
Yes.
Fluently?
Yes.
And Bulgarian.
Bulgarian, yes.
And how different is Bulgarian to...
It's like Russian.
Yeah.
Well, not exactly, but similar.
Yeah. So you can understand Ukrainian and Polish and...
A little bit.
So with osteopathy, we look at how the whole body functions and as to why. And with yours, you said you had a scoliosis. It was quite straight when you went down for a flexion to touch your toes, which shows that it's probably not specifically just that. Did you spend a lot of time using your right arm when you were working?
Yeah.
Yeah. So it might be just a compensation that's occurred so it causes your shoulder to go further into internal rotation or to be further forward. A lot of the time when people say they have a little scoliosis, there's obviously rotations and side bendings that's occurring through the spine. And then what would occur is sometimes you can see there's a rotation this way and the shoulder then compensates and sits further forward to be able to balance it out. For you, it's not too bad. You have more clunking through there, and then through the shoulder capsule on this side you can hear there's a bit more crevice.
That sounds great. I mean, that's only as I said, don't have X-ray, so it was.
And get quite tight through the lower back. You get sore through here? Yeah? Can I pull these down a little bit?
Sure.
Okay. Good breath. So what type of coaching do you do?
That's aesthetic and femininity.
Osteopathy, although I said treat like chiropractors. So the first osteopath was actually the teacher of what. So how chiropractic came about was that the first chiropractor was actually an osteopath. So there was a guy named B.J. Palmer. He was trained by Andrew Taylor Still at the university, which Andrew Taylor Still was the guy who theorised osteopathy in the United States. And chiropractic was then an offshoot of osteopathy. So we treat quite similarly, we look at the body in the same way. And how that all came about was that the medical system at the time they were finding that it wasn't making an effect on the actual cause of all the pathologies that were being presented. So he theorised an alternative type of treatment, mainly revolving around manual therapy, manipulation, and then incorporating how all of the other systems of the body, if they can be optimised through certain types of manual therapy, exercise, rehabilitation, and then obviously some therapeutic or sort of emotional sort of connections as well, to then find a way to allow for healing mechanics of the body to be able to start to fall back into rhythm. Sometimes it can include a little bit of what feels like some harder treatment, so some soft tissue, sometimes some adjusting. But it also can do, we can also use other tools, so some softer touch, a little bit more fascial sort of release, or visceral conditions. So we work through the stomach, through the intestinal tract. There are also some forms of techniques that, are with regards to trying to help with neurological lesions. A lot of osteopaths will also do dry needling, or some release work to the muscle tissue, as well as having an effect on the neurological system. And then we also work with, obviously when you massage something, you're causing blood flow to increase to the area. So getting rid of toxins or trying to release off trigger points or so forth. But the real question as to why we do this is so that we can allow the body to decrease its restrictions or its dysfunctions in the body, to increase the ability for the body to be able to clear out any metabolic byproducts, to optimize the neurological system or the lymphatic system, so that it can start to optimally heal itself. So we say treat rather than fix conditions or to relatively realign. We are not specifically putting anything back in. We're just increasing the range of motion and the function of that sort of area.
Understand.
Can I get you to take a big breath in? I'm just going to place my hand just here, let your hips go soft. And a big breath in again. And I'm going to place a little adjustment just through here. Good. Just let that lift. That's okay. Good. Just a little one. Lift your shoulder up, let that rest just there so your shoulder falls over that tap. We get you to take a big deep breath in and all the way out. Good. Hold this out. Just turn your head this way, and I'm going to put a little bit of pressure through your neck and push that shoulder down. Big breath in, and all the way out. Good. Ooh, that's okay. Sorry for that. A lot of pain through here still?
Not so much.
No?
No.
Through this one? Your left?
Yeah.
Still? Through the outside? No?
No.
No.
I forgot to mention that I use a massage ball, so
Yeah?
it's really helps.
Underneath the foot through
Yes,
here?
too, but also
Through the rest of the body?
Yeah.
Yeah. Yeah, I sell them to nearly everyone that walks in the door. I think it's the most useful tool. You can put one in your bag.
Yeah.
Yeah. So you said that you go to the gym, yes?
I don't. I do it. The exercises at home.
What in particular? What
Like
exercises?
plank or push-ups. And
Yeah. Any foot exercises still?
Not anymore. No. Well, when it hurts, I try it, but not on a like.
And what type of exercises would you do then?
Or just try to move the big toe and front and around to spread the toes in general. And there is an exercise with some gum band or how to say
Yeah, the band, yeah.
the band, yeah,
To open up the toe.
yeah.
Who taught you that? Was it a podiatrist?
But that's
Or did you see it online?
no, not online. It was on the treatment back then.
Yeah.
Yeah. It was so bad, so I went like every week for a few months. So now it's way better, but back then it was like everything was like frozen. It felt like it's particularly the left foot. It's like not mine. I couldn't really move anything.
You know what I'm massaging here?
Something that's really painful.
The lats and a little bit of the rotator cuff at the back, but not too much. And why is that the lat muscle, the latissimus dorsi, attaches to the front of the shoulder, and it can help to pull the shoulder this way.
Okay.
We're just trying to loosen it off, and then it will encourage it to sit a little bit more posteriorly afterwards, and give you a couple of little strengthening exercises to get it to pull back. Can I get you to turn onto your back if you can? Well done.
Yeah, sure. Well, it's always there's always potential for more, but it's
Yeah, of course, but it takes a lot of effort.
mm,
And it is, you're right, you said it before, it's a boring exercise to do.
it is really,
And
really
it's hard to see benefit because it takes a long time.
yeah.
But it definitely is one that needs to be taught to a lot of everyone.
Mm.
I think anyway. I see so many people coming with upper back issues and upper back, lower back, neck injuries, and they have no idea how to stabilize through their lower limb or through their feet.
Mm.
Not that it always correlates in that way, but I watch people walk down the street and I can see that they've never been shown how to walk correctly
Yeah.
before. Deep breath in and out.
I know. I know it.
Very light though, not too aggressive. It'd be nice and light, just more of a stretch this one. And grab this elbow. Grab you. Twist it. Good. Grab your elbow. Hold there. Arm through here. Big breath in. And out. All the way out. Good. Big breath in. And all the way out. I'm going to do a little drop. Good. One more little. Other side. Sometimes there's no need for big adjustments.
Yeah.
Straighten that bottom leg. Grab the corner here. Big breath in. And out all the way. Onto the back.
You think about sleeping without a pillow or like only with one, like this.
That fits in the neck.
Yeah, and a small one like for 2 years now,
Yeah.
and try to sleep just on her back, like not turning.
Yeah. And how does that go?
Yeah, it's better.
Mm.
It's better.
You breathe easier also.
Yeah, I mean sometimes I'm still turning, but most of the time try to like this and it's like it's a bit better.
Yeah, a lot of people come in for some of the main factors is sleeping in the wrong position, having your head in the wrong spot. I suggest that people sleep on their sides or their fronts to try and load themselves up with pillows on their front or try and force themselves to sleep. At least not putting their whole pressure on their necks and their extending. But overall you feel quite good. Not too many points of bother. That's it, no more moves. And Did you ever do the internal pterygoid release on anyone?
No, what do you mean?
They're releasing the internal pterygoids through the mouth?
Well, I use Botox. It's also helpful for some time. But no.
I'll show you. I'm sure it'll be interesting. So just opening your mouth and moving it side to side and feel the tightness within the musculature through the side of the TMJ. And just feel the tightness in there.
Yeah.
And then see how with you, some little kid fellow. So you can release off the tightness yourself from the outside by massaging through the masseter and so forth.
Yeah.
You can also release off the internal. So the internal pterygoid obviously attaches to near or just on the disc space in between the TMJ. And if you can release that off, you can find that you can gain a little bit of extra room and it can decrease the tension quite well.
Yeah. Well, for
Botox does the
diagnosis.
same.
Yeah, sure.
Yeah.
We call it otherwise, but it's for diagnosis, right? Just,
Yeah.
yeah.
Do you mind if I do this?
It's fine. Do it.
Okay. Open your mouth slightly. Close. Just relax your jaw. Just open. Close. Open. Open. Close. Open. All the way, stretch it out. Good. Open. Good. Close. Open. Good. Deep breath in and out. Deep breath in and out. That's all.
Wow. Thank you.
You're welcome.
Yeah. Thank you very much.
Pleasure.
And
Ciao.
yeah.
With my blue gloves on.
Yeah.